Vitamin B12, deficiency symptoms that shouldn't be ignored. Vitamin B12, a member of the essential B vitamin group, serves as a critical player in the intricate processes of DNA synthesis and the production of blood cells. It's a nutrient our bodies cannot manufacture autonomously, necessitating its acquisition from dietary sources such as eggs, poultry, beef, or dietary supplements. However, an unfortunate reality accompanies the passage of time: the waning capacity of our bodies to absorb this vital vitamin. Before we dive into the details, it's of utmost importance to stress that the information presented in this discussion has undergone rigorous scrutiny. It has been meticulously reviewed and fact-checked by qualified healthcare professionals. So, with complete confidence in the accuracy of our information, let's embark on an in-depth exploration of the unmistakable symptoms of vitamin B12 deficiency that should never be underestimated. Numbness and tingling in extremities. Vitamin B12 is a vital player in maintaining the health of our nervous system. This essential nutrient is responsible for synthesizing myelin, a protective coating around nerves that facilitates the transmission of sensations throughout our body. When vitamin B12 is in short supply, it can result in issues with nerve conduction and potential nerve damage. Individuals, especially older adults, who lack sufficient vitamin B12 may encounter tingling sensations in their hands and feet due to peripheral nerve damage. Unusual fatigue beyond normal tiredness. Feeling constantly fatigued, even after getting a recommended 7 hours of sleep each night. It might be time to examine your vitamin B12 levels. The fatigue associated with vitamin B12 deficiency is distinct from typical tiredness. This deficiency can also impair your concentration and cognitive abilities. This fatigue arises because your body's cells struggle to function correctly without an adequate supply of vitamin B12, resulting in a reduction in red blood cell production and poor oxygen delivery. When there aren't enough red blood cells to transport oxygen effectively to your body's tissues, you'll experience weakness, persistent tiredness, and mental confusion. Vitamin B12's role in mental health. Depression, a serious mental health condition, can stem from various factors, one of which is a deficiency in vitamin B12. Vitamin B12 plays a pivotal role in brain and cognitive development during pregnancy, infancy, and childhood. For pregnant individuals, it's essential to incorporate multivitamin supplements rich in folate and B12 into their diet. Some studies suggest that infants deficient in vitamin B12 are at a higher risk of developing depression later in life. While depression is a multifaceted issue with numerous triggers, including psychological trauma, the significance of nutrition should not be underestimated. Maintaining a healthy diet can contribute to overall well-being. The yellow hue of jaundice. Jaundice, medically known as icterus, manifests as a yellow or green discoloration of the skin and the whites of the eyes, primarily caused by elevated bilirubin levels. Bilirubin is a waste product produced when the body breaks down red blood cells. A deficiency in vitamin B12 results in fewer fully mature and healthy red blood cells, paving the way for the onset of jaundice. Typically, the skin takes on a pallid appearance tinged with yellowish hues in such cases. Blurred vision. Imagine looking at the world through a smudged window. This is how vitamin B12 deficiency can tinker with your vision. When this vital nutrient is in short supply, it can wreak havoc on your optic nerves, causing your sight to become blurred. It's a bit like trying to see clearly through fogged-up glasses. Initially, you might assume that it's time for a new prescription, but the real prescription could be vitamin B12 supplements. So before you pay a visit to the optometrist, it's prudent to examine both your vision and B12 levels. Muscular weakness. Do you ever feel like your muscles have lost their strength, despite your best efforts at the gym? Well, there's a deeper reason for this fatigue. Our muscles rely on a steady supply of oxygen to remain robust and responsive. This essential oxygen is transported by red blood cells, which in turn depend on vitamin B12 for their proper synthesis. Therefore, if your body lacks sufficient B12, your muscles might also feel weak and unresponsive, no matter how hard you train. Mobility hurdles. Vitamin B12 deficiency isn't just limited to blurred vision and muscular weakness. It can also take a toll on your ability to move gracefully. This deficiency can cause harm to your peripheral nerves, creating significant obstacles in your daily movements. Running, walking, and even the most routine tasks can become daunting challenges. You might experience numbness and weakness in your feet and limbs, making it difficult to support your body's weight. Even your reflexes may be adversely affected. In the face of these mobility hurdles, the solution is simple. Fortify your body with the right vitamins through a well-balanced diet. Headaches. Among the various neurological symptoms that can arise due to a deficiency in vitamin B12, headaches stand out as the most prevalent. If you're no stranger to frequent pounding headaches, it's wise to investigate your B12 levels and consider supplementing your diet. Irregular heartbeat. Low levels of vitamin B12 can lead to a condition called megaloblastic anemia, notorious for causing irregular heartbeats. Your heart, a tireless performer, might start to dance to an erratic rhythm. To restore harmony to your heart's performance, it's essential to increase your vitamin B12 intake and treat your heart with the utmost care. Memory fading. For those who endure prolonged periods of B12 deficiency, the consequences can extend to your cognitive faculties. Memory lapses, confusion, and in the elderly, even dementia can become unfortunate companions. To safeguard the sanctuary of your mind, make vitamin B12 a steadfast ally, boosting your vitamin B12 level. Boosting vitamin B12 levels in your body is crucial for overall health, and it can be achieved through dietary choices, supplements, or, in some cases, medical treatments. Here are several ways to increase your vitamin B12 intake. Dietary sources. Vitamin B12 is naturally found in animal-based foods such as beef, poultry, fish, eggs, and dairy products like milk, cheese, and yogurt. Include these foods in your diet regularly. Fortified foods. Some plant-based foods like breakfast cereals, plant-based milk like almond or soy milk, and nutritional yeast are fortified with vitamin B12. Check the labels to ensure they contain B12. Balanced diet. Maintaining a balanced diet that includes a variety of foods can help ensure you get enough B12. Incorporate lean meats, fish, eggs, and dairy if you're not vegetarian or vegan. If you are vegetarian or vegan, focus on fortified foods and consider a B12 supplement. Regular health checkups. If you have a medical condition or take medications that affect B12 absorption, like certain acid reflux medications, discuss with your healthcare provider. They can monitor your B12 levels and suggest appropriate measures. Conclusion. Don't underestimate the prevalence of vitamin B12 deficiency. It's more widespread than one might think. It can stealthily infiltrate your system through various avenues, including malabsorption, inadequate nutrition, digestive maladies, or autoimmune disorders. To champion your well-being, take charge of your health by regularly monitoring your B12 levels, adopting a nourishing diet, and embracing an active, healthy lifestyle. Your health is our primary concern. If you found this video enlightening, please show your support by giving it a thumbs up and subscribing to our channel for an abundance of informative content.